Back on MorningLine, thanks for joining us on this Wednesday. Nick, along with Clint Kelly, Malpractice. We're getting into more on these burns. We're talking about this case that just is very disturbing. Before we get to this, Eddie called back. We lost him just before we went to break. We'll take Eddie's call. Eddie, good morning. Hi, Eddie.
Yes, sir.
Hey, how can we help you?
I had a root canal done, and they gave me some antibiotics for the infection I had in my mouth. And I ended up getting C. diff.
Oh, yeah.
And I don't know if you know what that is.
I do.
Okay, he'll explain. Yeah. And so you got a condition. What happened then?
Well, I ended up in the hospital for about 9 days.
Okay, let's see. I'll keep him on the line if you have any more questions. Can you? What is he said he got?
C. diff is an infection. You know, typically people who get C. diff, they get it through things like, say, somebody's had an endoscopy and the scope wasn't cleaned and it was used for colonoscopy. So it's fecal material.
Getting into the throat.
It's it's a gut infection.
Okay.
Okay, and so the way that you get it, it's typically exposure to fecal material. Not always, but it typically is, because it's a bacteria in the gut, and when you get it into your system, it can make you really sick.
He said he spent 9 days in the hospital.
I believe it. It takes a long time to get over it. Now, he's fortunate. It sounds like he's gotten over it, but it does take a long time to get over it. And what it tells me, one of two things. Either he got it somewhere else, okay, or it occurred during the root canal. And if it occurred during the root canal, I've got to wonder what in the world are the instruments this dentist is using, because how do you get something like fecal material?
Yeah, you know what that would be? It's someone handling it that went to the bathroom and didn't wash their hands.
That's probably it.
Blech. I'm just guessing off the top.
Either way you look at the tools were not properly sanitized before they were used. Okay, and if it's from the dentist.
His question too, I guess, for calling in today is, why would this maybe be a case that you would not take?
It sounds like there's not going to be permanent damage.
Hopefully he's okay.
Yeah, I mean, if it's me, I'd much rather recover and have a health care result that's good than not recover and have to call somebody like me.
Right.
Now, he may say, well, I should get some money for what I went through, and I certainly would not disagree with him. The problem is the law, the way it's set up right now in our legislature, they don't help people like Eddie.
No.
The laws are too strict. You spend $50,000 trying to get $50,000.
Yeah, so that's the thing. Clint has to take the cases, I guess, when they're bigger on this. It doesn't sound like there's any question something standard of care was not done properly.
If I were Eddie, though, I would go talk to that dentist after, assuming he's recovered enough, I get the medical bills from the hospital, I'd say, dude, you have to be the cause of this. You should pay this bill. There's no excuse for giving a dental patient C. diff.
Gotcha.
None.
Do you, by the way, often handle any dental cases?
Very rarely.
Rarely.
Very rarely.
I appreciate your call on that, Eddie. I think that's good advice from Clint. All right, so let's get back to this burn. I think we all, if you've been to the hospital, my colonoscopy, I had an IV.
Yeah. Everybody who's had some kind of procedure has, they take the catheter, which is the needle on the end, and they stick it in.
Right.
And then the nurse goes in there and she's trying to find a vein.
Oh, yeah, they were tapping a bit.
Okay,
I was dehydrated. You know how you're dehydrated before that? So they were having trouble finding a vein, but she did a great job. She found it.
Well, most of your hand is tissue.
Yeah.
In between these areas, that's just tissue. Very few veins in here. So you have to very carefully find the vein. And someone might say, well, how do you make sure you've got the needle in the vein? It's real simple. Once they stick the needle into the vein, if they successfully capture the vein, they will pull back on it and they get it's called a flash. It's a little bit of blood comes back. You've probably seen, you've seen movies where like heroin users,
they pull some in and they go back.
It's exactly the same principle.
That tells them they're in the vein.
Exactly. Same principle when you're dealing with IVs.
Interesting.
And that's how you ensure that you're in the vein. Well, in this case, this nurse didn't get a flash because she just didn't do it. So she buries this thing deep into this man's hand, walks out.
Okay, and he's got an IV with something dripping in there.
Very fast. It's calcium.
What was it for? What was he there for?
He had a heart condition.
Okay.
I wish I could remember what the calcium mix is, but it's used to treat the heart condition.
Okay.
And it's a push pump. I mean, it gets in there pretty quick. He starts to feel pain. I don't know how many minutes later, 10, 15 minutes later, whatever. So clicking on that thing, get in here, trying to get the nurse back in there.
Yeah.
Of course, she gets in there. By the time she gets in there, the top of his hand has begun to swell, because the fluid's not going into his
It's building
vessels.
up in there.
Yeah, it's good. It's spilling out into the soft tissues and starting to fill up his hand. He's getting that swollen hand, looks like a boxing glove. So of course they get the doctors in there and they, you know, aspirate the liquid out from his hand, and then immediately began to give him a saline flush, try to clean up. Well, the damage is done by then.
Well, how was it? Already passing up?
Oh yeah. It's leaked in here, and it gets into his up above his wrist, and it's just killing tissue. That's all it's doing. It's just like that necrotizing fasciitis.
Yeah, okay.
Really kind of a similar situation.
Yeah.
You're just killing tissue as you go, and it got deep, really, really deep. And all you can do at that point is treat it like a third-degree burn, because that's in essence what it is.
But it's inside under the skin, kind of. Yeah.
Yes, but it eats up under the skin, and that's what's killing the upper skin, because once it gets below the dermis, the top dermis begins to die.
Sure.
Because it gets fed below.
Off. Yeah.
Long story short, he's got a burn from here up to his elbow. He's going to have grafting done, which is they're going to take skin off the top of his thigh, sew it onto the top of his forearm to repair it, because you can't leave that open. You can't just let a scar grow on that. It'll never make it. It'll break and tear, and he'll have all kinds of problems.
So much movement.
So you put a graft on there, and he's going to an orthopedic surgeon because the burn was so deep into his hand, it's damaged the radial and ulnar nerves, and those are the nerves that control your fingers. And it's his ring finger and his middle finger he's having difficulty with. So the surgeon's going to have to go in there and try to find a way to either restore the function of those nerves with the plastic surgeon helping him, or he's going to be stuck with permanent nerve damage in his fingers.
He's sitting there, this is all going on. At what point does it dawn on, obviously he's in pain. He knows this isn't what should have happened. They react. Did they say anything like, oh my gosh, it's backed up? What did they share with him?
They just come in there. They don't say anything. They just come in there and just trying to work on it. You know, this one of these things.
Okay.
Nick,
but they're not telling him. I would have been sitting there saying, I would have asked, what's going on here? What's happened here?
Yeah, well, he's hurting.
Okay, yeah. Maybe you're in so much pain.
It starts out slow and it begins to creep up. You know, it's like it just all of a sudden it hits you. And by the way, it took him a while to get in that room. Yeah. He's hitting the call button and it's taking time. There was a significant delay between the time he hit the button and the time they went in there. So the question you have to ask yourself is, what would have happened if they responded that quickly?
Yep. Or, again, standard of care, she didn't do the blood draw.
No question. I mean, that's what I'm saying.
Now, how do you know she didn't do that?
Because this doesn't happen unless you do it.
Okay.
You know, I mean, if you
had hit the vein, it wouldn't have happened.
Sure. And actually, Nick, the standard of care also is, in a situation like this, you monitor for a while to make sure that you've got it in the right place, because they can tell as the IV begins to proceed whether it's getting into the vein or whether it's not. There's a pretty easy way to do that. A guy his age, particularly with someone in his situation, you want to wait about a minute and check on it. You'll just stick it in and take off.
Yeah.
She was a newbie. She was an LCP licensed.
Well, they were going to discipline her.
Nurse.
Well, we make mistakes. That's why you stick to standard of care.
That's no apology to him.
I'll tell you what, it's interesting you talk about IVs, because more about burns maybe, but my brother once had to go in for a surgery. He was having an appendix out, and they put the IV in. I think he was just getting fluid, nothing caustic like that. Whenever it started, all of a sudden his arm was just hurting. It just wasn't going anywhere. It was backing up. The nurse finally came in and she pulls it out and it starts shooting all over the place. Oh. Now, he didn't suffer any permanent damage, but I mean, IV stuff, that should be pretty basic, shouldn't it?
It is basic, and this is an extremely rare situation because the vast majority of nurses doing this know what they're doing, and they check. It's just like operating on the wrong patient.
Right.
You follow the timeout procedure, you're going to make sure the proper patient is identified. Right. You do the flash, the blood flash thing to make sure blood comes back as it's in the vein. You know you're in the right spot. But clearly she didn't do that.
All right. Any other aspect of burns that we're talking about?
Yeah.
That was an amazing case. In fact, I think we need to do a story on that.
Yeah,
when the time is right. Okay.
And there's another one involves a guy who had a very prolonged neurosurgical procedure. He had a fusion done on his neck and his back, and so he was in surgery for a total of 10.5 hours. Jeez. All kinds of hardware put in.
Same doctors, or they rotate in?
Different. Same neurosurgeon.
But he's out that whole time. They're doing all these things.
Correct. Well, what they do is after they knocked him out, they turned him around. You know, he's laying down like this. They give him the anesthesia, knock him out, and they turn him around. They lay him on a table where he's in what's called a prone position. He's down on his stomach, so he's laying down out like this. And what they're supposed to do is put very extensive padding. So that nowadays they've got this like silicone padding that they can put the body on, which gently
soft. And
Soft
kind of like
on
cushion.
pressure points. Yeah, because
Oh.
pressure points. Why do you do that? If the pressure points stay in the same position for a long period of time, that compromises blood flow and therefore oxygen to those parts. And so the skin around those areas begins to die.
And you're talking 10 hours.
Correct. And if it stays like that long enough, blisters develop. And that's what
It's like a bed sore.
Exactly.
Okay.
Exactly. So when he wakes up and they take the gown off, he's got bed sores all across his chest, a giant one up here on his shoulder, and one down here by his hip, because those were the pressure points where he was laying down. All because the nurses did not get the right bed for him and then didn't check him. Because what they're supposed to do during a prolonged surgery, you check those pressure points to make sure that he's not moist or something's happening.
Or if it's turning red, just move him around. The idea would be to move or get something else under there?
Yes,
get a different...
yes. You can. The surgeon can come back, back off, and they can maneuver him or get something softer up under that point to protect the skin. But you got to be watching it, because if you don't watch it,
so he wakes up and sees this, and he's got dead skin.
They saw it. They took the gown off, and there he is. They told him. He looked in a mirror, and of course his mouth fell agape.
Is this one of your cases?
Yeah.
What happened?
We just sued. We're probably going to settle this case early on. I don't think I'm going to have any trouble with it. But the one thing I want to know, because I can't tell on the front end, the medical records talk very little about it other than he's in wound care getting treatment. I want to know how this happened. I want to know why it happened. It happened at one of our best hospitals in Nashville. And so I'm having a trouble understanding how this could happen. And frankly, I think the hospital needs to know what's going on to try to prevent things, because what it tells me, it's not the surgeon's fault. He's not responsible for positioning the patient. That's not his job. His job's to cut. It's the nursing staff's job, mixed to some extent with an anesthesiologist. But I want to know how this happens.
Yeah. It's standard of care, and that's the thing. A lot of people talk Clint's suing to get damages for his clients. Of course, Clint makes money off of that. But to me, the reason I love what you do is that hopefully, with an expensive settlement, the hospital sits down and figures out what the heck happened here, and let's never let this happen again.
And it does.
That's what it's about.
A lot of times, I've had defense lawyers tell me it happens a lot from these lawsuits and settlements. They change policies.
Well, if you don't make them feel it, what incentive is for them to change it if they're looking to save money and cut corners?
And I can't tell juries that. I wish I could, because the judge won't let me. But I can tell the public this. People say, well, gee, why don't they just get over it? Why do they need to have a lot of money? Whatever. The money causes the changes. When they have to take a pen and scratch out a big check and send it to the patient from the risk management side,
they don't want to do that again.
They have to justify that on the books, and then they have to ask themselves, okay, what can we do so we don't have to keep writing these checks all the time? Money changes things.
Clint, this is a great show. It's good to have you on. We're going to let you go, but when we come back, I'll make sure folks know where your office is there in Hendersonville.
That was a fast hour.
That was good stuff. Hey, Clint.
Good to see you.
It's good to see you, my friend. Take a break, programming note, and stick around. We'll have the number. If some of you have questions or comments, if you want to call in because it's a personal thing with this medical stuff, I'll have how you can contact him right after this.